Good morning, dear all. Myself, R. KAVIYA SREE from SALEM, TAMILNADU. So this is a case of infertility. I said to the patient, tell me. She said about menstrual issues. I said whatever. Then she narrated her complaints as pain in her legs and ankles, then lot of stress, tension, hair fall, menstrual irregularities, pigmentation around her neck and weight gain. So I asked what's the most bothering issue for you. She said her most bothering issue is lot of pressure and not able to control it. So the pressure is about she will handle everything in a controlled, calm manner, but now she is getting anger. She said generally she won't express her tension to outside people, including her husband, but now she is expressing her anger. So I asked what's the issue in expressing anger to others. She narrated an issue with her house owner. The issue was during the death of her father. The house owner consoled her, but it makes her anger. And especially he said, why are you behaving like a fool and acting like this? You have to face it. So I asked what is the most sensitive issue for you in this? She said he is finding faults in me. It created a lot of pressure and I was not able to face him. I asked, so what? She said, then everything seems fake, whatever I done for him, like taken care of his children by cooking, cleaning, and helped them to buy groceries. I helped them without any expectation, but they mistook me. I asked, for example, if there is someone who is helping others, but they mistook them, how it will be for him? She said, broken. I asked, broken? She said, not able to move freely. I asked meaning. She said, not able to ask help if I need. Actually, she is a love marriage. So I asked, what's the thing you like in your husband? She said, he will be caring, supportive, and he will handle the situation in a calm manner. So previously also she said about this calm issue. So she likes to be in a calm and controlled manner. So she is also projecting the same thing in his husband also. So I probed that. I asked calm manner, just calm. Then she narrated an incident during his college days. There is an issue in her college hostel. His husband solved it in a smooth manner and it gave some sort of good appearance among the staffs. Or else it will create bad opinion among college staffs and we won't able to face them and leads to loss of respect. So I asked her experience in this scenario. She said, I'm not able to face them and some thoughts like we have done mistakes. So I asked in general, what will happen if we done any mistakes? She said we can't ask for any help, like if you want to buy anything or if you want to go to any places. And also she had a fear of drunken persons. The fear is about they won't spend money for their families and for their children. So wife have to depend them for their daily necessities like groceries, schoolings and for buying things. So I asked what's the issue in not spending. She said family will suffer. They won't get earning, affection, care and they won't have respect. If the husband is alcoholic person, the wife will not get respect. Then it will spoil her name. Generally, others will have some sort of standard opinion on it. I asked her experience in this scenario. She said it will be shameful and physically her experience is shivering, trembling, shock, giddiness and chillness of extremities. So, she had the same experience while facing the examinations and during the death of her father, who is her strength and support her decisions and he is the one who guides her. So her peculiar characteristics are for her, and also she said for her the care is buying neat and good clothes. And for her the consolation is aggravation. She wants to, so the main essence of case is she wants to maintain her image to the person whom she seeks help in every situation. So I prescribed her Calcarea silicata 203 dose and SL for 1 month. So the reference of Metramedica is from Soul of Remedies. The feeling of Calcarea silicata is I need to keep up to a particular standard to get the security and protection I need. The need to maintain a certain standard gives the Calcarea silicata is sensitive to reprimands. When the person who support him dies, Calcarea silicata is devastated and may go into a shock state. automatic conduct. He may either sit still and do nothing or is a survival mechanism. He may imagine that this person is not dead and may talk to him. So this is her follow-up. After 1 month, her pain in legs reduced and her old complaints started to reappear, like her mouth ulcers reappeared. Then also occasionally she had a pain in her lumbar region, which is also her old complaint because of right renal stone. And her thirst increased and also her sleep is also increased, her appetite decreased. So then, and also she had a lot of dreams and she also feel pressure and tightness in her dreams. So I prescribed her calcareous silicata 1 ounce single dose. Then after 15 days of follow, her overall pains or everything was reduced and she had a menses 1 to 4 days with clots. Before she had only spots or like streaks only. And also she had dreams of talking to her father and sharing her old memories with her father. So I prescribed SL for 15 days. Then she had, nearly 75% of her complaint was good. Then her mind is also good. She also, actually she came to me during after the death of her father. She's not able to handle that situation of his father's death. So after taking this medicine, she is now able to come out of that situation. So after 15 days of SL, then again she got his old complaint, like sneezing because of his dust allergy. Then also she got disturbing dreams. The experience in her dreams is anger, so I prescribed her calcareous silicata 203 dose. Then after 15 days of follow, she got her pregnancy test is positive. This is before treatment. This is after treatment. Thank you all. Thank you everyone for giving this wonderful opportunity. Especially I would like to thank Dr. Shekhar sir and Swera Academy for giving this such wonderful platform to present such a case. Thank you sir. Thank you all.
Good morning to everyone. So good morning sir. I would like to thank the Swara team and also CC Homeopathy for this great opportunity, and it's my pleasure to get into that competition. So without any delay, we can go into that. And before that, I am Dr. Anitha, and I'm working in Manitham HOMEO Healing Center for the past 2 years. So we can go to the case, and I would like to share the slide. So here is the case, a case of eczema. And before that, a female patient of 42 years came with the complaints of itching and blackish eruption in both the forearms since 2015, that is 7 years. And regarding the history, she said that, and this is the history is something quite interesting. Watery sticky discharge of blackish eruption is present. And the ailments is something very quite interesting that she told that one day she was sitting in the sofa, some spider is fallen in the forearm, it seems. And because in that the spider emits some nauseous agents or something, secretions or saliva that it seems. It started irritating, and she started rubbing in that part so often. And after some days, she noticed that patches of hair is lost in that forearm, and she was quite disturbed in that. So she started complaining to me that in first, a watery sticky discharge is present, And initially, the eruption also is small in size with intolerable itching. And she also told that first the eruption start in right forearm, and later, 6 months later, it start in left. She told that she used some coconut oil and lemon for the external applications, but it is what it is like temporary relief. And the itching and eruption is aggravated by salt water and amelioration by scratching. And even after scratching, it burns a very lot, and it cannot be tolerable to her. So regarding the past history, she had chickenpox and typhoid in her childhood. And treatment history, she was undergone some medications like Siddha and Unani, and she got some temporary relief. So regarding the obstetric history, she is the mother of 2 sons, and her menses is normal, and every other history is normal. Regarding the physical generals, her appetite is normal, and all the generals are normal, except she is so much desire for sour things and spicy things. So she always wants in a daily meal. And her urination is rarely it gets burning. And she told that she can't tolerate much cool or AC room. So she is under the chilly patients. And this is the most important part that in homeopathy it is something so beautifully seen in mental generals. And this is the case. I thought how homeopathy is beyond that, we can't even imagine about it. I saw the way of speech and the way he presented the symptoms is quite something very different. I can't even imagine like that. So she said that she is very active, and I'm not able to sit in one place, ma'am. I want to roam in the room and can't keep a minute in sitting in that room. And she is always very restless. And she said that I want to be occupied both mentally and physically, and I can't even imagine that free time is that for me. No, I started to work again, and she is like a mania to her. So she wants to do a very lot of thing in her. And after that, she is very interested in music, and she's told that if one day I hear that the song means I started dancing, and it is very mesmerizing to me. She said that. And her hobbies was doing crafts and artwork. This is her hobbies even in her childhood. She started to doing a little things in her life. And in my observations, she is talkative, non-stop talk in her, and she the way of talk is very animative, and the hurried behavior, hurried nature is seen in her talk, and the way she presented to me. She loves very fast, hurried games like running, and like speedy games she like more. The fear means she is a fear of being alone and of dark and loud noise. So, ma'am? Okay, ma'am. Okay. So, rubrics I have taken as sensitive, oversensitive, noise, sound, aggravation, tarantula, and fear of being alone, tarantula, industrial mania of for work, tarantula. So, it is very quite interesting that how surprisingly her ailments matches exactly to her state. It is how the energy pattern is matches to the state. It gives a best idea. So after a prescription, tarantula 200, totally I have used 4 doses of tarantula intercurrented by sulfur 1 dose. And her follow-up says that in 3 months, itching slightly present, and the changes, the blackish discoloration is reduced and mind more active and whole feels normal. And the last 3rd month, she is all so fine and skin becomes normal and no discoloration remains, no itching is present, and the hair started to grow in that place. So here is the image and before and after pic. So thank you for this opportunity to me, and thank you for all the participants, and all the best for the participant. Thank you, ma'am.
Thank you. Very well presented, Dr. Anitha. Very nice.
Thank you, ma'am. Thank you.